Hey you guys, this is Isaac, and I am here to talk with you more about HIV and AIDS. I feel that over the past week since I've been doing this, I feel that over those couple of days that we've got HIV 101 out the way. What I mean by when I say HIV 101 is that we talked about what is a HIV and AIDS. We talked about how do you get HIV and AIDS. We talked about the signs and the symptoms and the statistics here in the United States and around the globe. So now I want to move on to another portion before we get into our prevention area. Let's first talk about reducing the risk. Now, sex is something that's inevitable. We're all going to do it at some point in our life. May you be gay or straight, we're all going to have sex. And there are some of us that are going to have it more often than others. Then there are some that are not. So today's question is, how can I reduce my risk of getting HIV through sexual contact? As I said in my previous videos, we were talking about how you contract the virus in the United States. The main way of getting HIV is through sex. Point blank simple. So there are numerous ways that you can reduce your chance of catching it through that. For example, let's go through a few. Choosing less risky sexual behaviors. Oral sex is much less riskier than anal or vaginal sex. I know this sounds weird because transmission of HIV, especially if you're having sex with someone with HIV, is you have to pass bodily fluids. Bodily fluids like vaginal juices, sperm, and things of that nature. So, I mean, if you're having oral sex, I don't know too many people who have oral sex with a condom on top of it. That just sounds weird to me. I mean, I've heard of it, but I mean that would possibly be a way if you're gonna do that, or just choose oral sex because there is a small chance. Oral sex is less riskier than anal or vaginal sex. Anal sex, as I mentioned before, is the highest risk sexual activity for HIV transmission. If you are HIV negative, insertive anal sex, or what we call it in the gay community, topping, is less riskier than receptive anal sex, what we call bottoming. But you also have to remember that HIV can be transmitted through blood, semen, pre-seminal fluid, pre-cum, rectal fluid, vaginal fluids, sexual activities that do not involve the potential exchange of these bodily fluids carry no risk for HIV. Kissing, no risk. But practicing less sexual risky behaviors. I'm not gonna sit here and say dry hump. That's why I'm gonna move on to the next portion because none of us are gonna dry hump unless we're like 10, 9 years old. Don't act like you don't know what I'm talking about. When you were little and y'all played house and y'all started dry humping each other and whatever. With choosing less risky sexual behaviors, it's important that we use condoms consistently and we use them correctly. You can lower your risk of catching the virus if you use a condom correctly. Yes, there is a correct way to use a condom. I wish I had a banana or something. I need to go to the grocery store, or a cucumber. I think I do have a cucumber in there. No, I ate that last night on the salad. It was very, very, very good. Um, so I can show you the correct way to use a condom. But we're all adults here, and we should all know how to use condoms. I hope that we all know. When using a condom consistently and correctly, condoms are highly effective in preventing HIV and other STDs as well. Um, I hate to bring this up because I don't like bringing up personal things. I actually got into a debate with a good friend of mine behind this topic because he's someone who doesn't like to use condoms. So, and we were talking about all the different ways, but I could not stress the fact enough to him that though condoms, sometimes accidents happen. They break, they pop, you know, but 9 times out of 10 they won't if you're using them correctly. How to use a condom correctly? You don't use oil. You use water-based lubricants on a latex condom. You don't use oil. Don't use baby oil, lotion. Use water-based lubricants. My favorite one, by the way, is called Wet. You can get it anywhere. The sex store, CVS, Walmart. You can get Wet anywhere. I personally adore Wet. I also like Astroglide. Astroglide is very old school, but I mean, if you're going to do it safely. Use a condom. Use that condom correctly. Using that condom correctly meaning you have to use the right lubricants on that condom. No oil-based lubricants. Some people like to use gun oil. Gun oil will pop a condom. Because that's exactly what gun oil is. It may be the slickest of them all. You put it on there and it goes right, boom. I mean, I hope nobody in the world is that dry in certain areas. In certain areas. Okay, let me get back serious and stop being silly. But you have to use condoms correctly. Another way of reducing your risk is reduce the number of people you have sex with. Um, as I said in the beginning of the video, there are some of us that are going to have sex more than we should. Then there are some that are only going to have sex a couple of times. I want to say it was about 2 years ago, a survey that I read. It was talking about how many sex partners a person may have in a lifetime. The number was extremely low. It was like 5 in a lifetime. I'm like, what day and age are we living in? I can flip through my black book that I personally keep for myself, and because I write down the people that I sleep with. I know it may sound weird, but being a sexually active person, if something was to happen, I want to know who was held accountable. I write down names, when and where we had sex, what time of day it was, the month, the year. Now, there have been some times where sometimes I just didn't catch the name. I just write sex down. I like to keep a log just because I know I was highly sexual active during that time. So reducing the number of people you have sex with, that could help. I mean, I can't sit here in front and say I probably would not be in this predicament right now. I'm really not going to call it a predicament because it's not. It's an issue that is getting out of hand. Now it's been getting out of hand. A lot of us probably would not be taking HIV medications or have the virus, or a lot of people may have not died from HIV or AIDS if the number of people that they were sleeping with were small. The number of sex partners you have affects your HIV risk. The more partners you have, the more likely you are to transmit HIV or to catch HIV or any other STD. Both of these factors can increase the risk of HIV transmission. 1 in 6 people living with HIV are unaware. I was one of those 6. I was totally unaware. Totally. I had a boyfriend at the time as well. We were sleeping together. When I found out, I was so devastated because I was like, oh my goodness, I could have possibly given this to him. I didn't know. I had no clue. That's why it's important that we go get tested, which we're going to get down to that. That's a little bit lower on my list of things. But that's why it's so important. Reduce that number of people you have sex with. If you have sex with 10 people a day, reduce it to 2. If you have sex with 20, reduce it to 2. A matter of fact, reduce it to 1. Find that one person. I know that's something that everybody longs for, that one person that they could just be with. Find that one person or don't do it at all. I mean, sort of try to practice what I'm doing. I'm practicing celibacy right now. Just so I can get myself back together and clear my head, because trust me, this is an overwhelming process to go through, finding out that you're HIV positive, finding out, well, then looking back at your life and seeing all the mistakes that you personally did. I struggle doing that every single day. And the number of people that I have sex with, which I will not disclose. Those of you that know me, we know what it is. Those of you that don't, it's none of your business, and I'm not going to disclose that number. But, I mean, just the way I'm talking, you can imagine it's been quite a few. Another way that you can reduce your risk is talking to your doctor about a medicine that they call pre-exposure prophylaxis, or you can just call it pre-P for short. Pre-P is taking HIV medicine daily to prevent HIV infection. The pre-P should be considered if you are HIV negative and in an ongoing sexual relationship with a person that is HIV positive. Pre-P should also be considered if you are HIV negative and have had sexually transmitted diseases or any other anal, receptive, or insertive sex with a male partner without a condom in the past 6 months and are not exclusively in a relationship with a recently tested HIV negative partner. We're going to talk more about the pre-P on tomorrow, because there's a lot more information that I want to get you. Now, I know one thing that I did just say, that it's taking HIV medicines daily to prevent. I like to quote on that word and put it in quotation, prevent. There is no cure for HIV. There is no substitute. And I'll explain to you what the medicine actually does on tomorrow when we talk about it. But it's something that's gonna be a long discussion, a long talk, which brings me back to a friend of mine, and maybe I can get him, maybe if I can see if he's willing to get online, because he said he's going to talk about, maybe see if he's willing to get online and talk, discuss this with me, just to make sure I cover all the bases on it. From my understanding, this pre-P stuff is relatively something that is new. I feel that if it would have been something, I think I saw, is there glitter on my face somewhere? I seen a shimmer. Yeah, it's somewhere on here. It's somewhere on here. I seen a shimmer. But, I feel, I'm not going to say I'm biased towards it. I'm not going to say that I'm against it. It's just I don't know much about it. So allow me to do my research on it. It's in my notes, because that's what I've been doing research. I want to make sure that I'm very accurate when I'm talking about this pre-exposure prophylaxis. There's also another one called the post-exposure prophylaxis. It's when you should talk to your doctor if you feel that you've been exposed to the HIV virus within 3 days. You should go and talk to a doctor about that. An example of that, of a possible exposure, if you have had anal or vaginal sex without a condom with someone who is, or you may know is HIV positive, and you are negative and not taking the pre-P, your chance of exposure to the virus is lower if your HIV positive partner is taking their antiretrovirals, which we talked about on yesterday, consistently and correctively. Starting the PEP, or the post-exposure prophylaxis, immediately and taking it daily for 4 weeks reduces your chance of getting HIV. Now, once again, I'm going to talk about that tomorrow along with the pre-exposure prophylaxis. Why I'm going to talk about it tomorrow? Because me personally, I feel that there is no safer way than using a condom. A lot of people that I have spoken to, including my friend, he feels that if he takes this medicine and not use a condom, he won't get the virus. I feel differently. It said it prevents. It lowers your chance. It lowers your chance. And I'm going to talk about more about the medicine, because I actually found out more about the medicine and doing the research for today this morning. So I'm going to talk about more about that tomorrow. But I'm sorry, it's just something that's very important. I might post another video today talking about it. I don't know. But let's move on. Another way you can reduce your risk is getting tested and treated for other sexually transmitted diseases and encourage your partners to do the same. This brings me back to reducing the number of people you have sex with. Now, if you don't feel comfortable reducing your number of people that you have sex with, some people, that's their profession. I don't knock it. It's the oldest profession in the book. Make your money, honey. Like my favorite movie said, make the money. Don't let it make you. All right, we all know what the Players Club quote is. So, in those words, if you're going to have multiple sex partners, and those multiple sex partners are going to have multiple sex partners, make sure your multiple sex partners are getting tested before you guys do anything. You know, schedule it. Schedule you. If you're going to have sex on Friday, you need to schedule with them. You need to call them on the phone, schedule. Well, can we go by this HIV clinic real quick and just get a quick HIV STD test? You know, we can do this on Tuesday. I am free at 12. What time will you be free? You free at 2? I push my 12. I push my lunch at 2 then, and we can run up here to this free clinic right quick. It's going to take 20 minutes. They got more than one person giving the test. It'll take 20 minutes, and we can be out of there in 20 minutes. We still got 40 minutes. We can go have sex then, or we can go have lunch and keep our Friday appointment. I know I'm being silly right now, but I'm serious. I'm actually being serious at the same time. If you are sexually active, getting tested at least once a year for an STD is important, especially if you know you are sexually active and you are in the process or probably are putting yourself at risk for HIV. It's important that you go get tested every 3 to 6 months. I was going to get tested every 6 months, which is what they really do recommend, every 6 months getting tested for getting the HIV test, especially if you are gay, homosexual, if you are a man that likes to sleep with men. It's very important every 3 to 6 months. Go get tested. You know, there are a lot of testing centers, a lot of free testing centers all across Houston, all across Texas, all across the United States. If you go online, you can find a STD testing site near you. I know here in Houston, to be honest, the Health and Human Services Department, they actually have a place, they have several locations where you can go and get tested. For those of you that are in Houston that are watching that video, it's located over there in Sharpstown. And in Sharpstown, I have to get the exact address. I will try to put that in the description part. But the testing is free. You just call, and there's a lot of places. There's another place to go to called Busy Bee off of Bensonet. I'll put their information down there. It's a lot of places you can go. You know, because getting tested is very important. Lastly, if you are in a relationship with a person that is HIV positive, make sure that they are taking their medicines and taking them correctly. The antiretrovirals reduces the amount of HIV virus in the blood and body fluids. If taken consistently and correctly, the antiretrovirals can keep people living. It keeps them healthy for years. As I said yesterday, since I've been taking them, I've only been taking them for a month. 1 month. I've only been taking them for a month. I've noticed a drastic change. You know, I said yesterday in the video, there are these spots on my hand, and they were deep, dark brown spots. If you look in my hand, if you can see my hand right now, my hand is clear of those spots. You know, I wish, you know, I had the courage to start this earlier when the spots were still there, so I could have showed you the progress. I mean, it was even over my arm, on my foot. I just did my feet the other day, and my feet are even clear of those spots. So when you're taking those antiretrovirals correctly, it does really reverse a lot of the things that HIV can do to your body. I will say, it does make me feel drowsy on some days. It does not. It's some days I don't feel as great as I should, but that's what some medicines do to you. I mean, people who have cancer go through the same thing with their chemo and radiation therapy and with the medicines that they take. Um, I'm back to a size 34 waist though. I can't say I'm proud about that. No, that's been a account of a lot of working out and a little bit of this virus. I'm just saying it does make your weight go down. But I'm just trying to find the humor in things because that's the only way you're going to get through this. If you know someone who's HIV positive, or if you yourself are HIV positive, the only way you're going to get through this is by laughing through it, finding the humor. In these videos that I'm posting, I may get off topic and giggle and talk about stuff because I have to find the humor in it because it gets me down sometimes when I'm talking about this because I have to, it's like looking in the mirror and I have to look at myself and see that I was this person. I was that person who had multiple sex partners. When I wasn't in a relationship, I had someone for Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, and Saturday. And sometimes on the weekends, I'll double or triple up. That's the reality. That's who I was as a person. And if I could have reduced that number, if I would have used condoms more consistently than I did, I probably wouldn't be sitting here talking to you about this in the manner that I am now. If I would have chose less risky behavior, it maybe things would have been different. Who's to say? But they're not. I am here. I am HIV positive, and there is nothing that's going to change that. But taking my medicines correctly are heavy. I don't know if I want to end this video so soon. But of course, you can also reduce your risk of getting HIV by not having sex. Like I said, I'm practicing celibacy right now. I know that we're all going to do it at one point in our lives or not. Gay or straight, hetero, homo. We're going to have sex with someone at least one time in our life. If you don't, I don't know how you did it. I don't know how you avoided it. Thumbs up to you. I need to call me, email me so I can find out your secret. Because like I say, if you want to reduce your head chance 100%, you can just not have sex. Become a monk. Become a eunuch, a nun if you have to. If you're that terrified, because if you aren't having sexual contact, you are 100% protected from getting HIV in that way or any other STD. If you are having sex, you can reduce your risk if you and your partner are being tested and know that you both are HIV negative and you practice monogamy. Now, for some reason, every other mammal in the animal kingdom can be monogamous, but us human beings. I don't understand that. When a lion finds when a king lion finds his queen, they're joined for life. When a male penguin finds, because penguins are mammals, people, yes they are. When they find their mate, they're mating for life. Elephants are the same way. For some reason, I think the monogamy gene or whatever it is in those animals skipped over us as humans because being in a monogamous relationship is something that we just don't know how to do. I'm putting it out there. I'm not saying it's everybody. Yes, there are some faithful people. When I'm in a relationship, I am in that relationship. I'm not seeing anyone else. I'm not sleeping with anyone else but that person I'm in a relationship with. Now, when I'm out of a relationship, that's a whole other subject. But being monogamous means you are in a sexual relationship with one person. Both of you are only having sex with each other. However, monogamy may not protect you completely unless you know for sure that your partner is being monogamous. I mean, I can say that I'm monogamous all day, every day. I can't speak for my partner. Just like I said in previous videos, you cannot be sure that the person that you are sleeping with isn't sleeping with someone else. How are you going to know that? Cheating happens every single day. That's the worst thing in a relationship. We always say, oh, they're not cheating on me. They're not cheating. They wouldn't do that. And in some cases, you are correct. You do have those stand up people. I'm sorry, this is the phone. Who is, oh, baby, that's bill collector. I ain't got time for them. We do have some people that are stand up people and they, love their partners and they don't cheat on them. They want to be with this person for the rest of life. But then we just have some people who just don't know how to be with one person. So you can never be sure. The risk of getting HIV through sexual contact varies widely depending on the type of sex that you're having. Like as I said, if you are in the gay community, if you are gay and you have sex with men, if you are a bottom, your risk of contracting the virus is high. The risk of getting HIV from receiving anal sex or bottoming without a condom is higher than any other sexual activity. I that's the fact of it. Insertive or topping is less riskier. But I'm not condoning that, just all the bottoms become a top because we all know that ain't gonna work. Some of these bottom girls, baby, they just bottoms. They gonna always be bottoms. Girl, use a condom, girl. That's all I can say. Miss Ma'am, you better get a condom. That's all I can say about that. The partner receiving anal sex is at greater risk than the partner performing the topping because the lining of the rectum is thin and it may allow HIV to enter the bottom. It's sensitive back there, just like the vaginal lining is very, very thin. That's why vaginal sex is the second highest way to get HIV. The lining of the body in those areas are very, very thin. And get bruised, injured, and things could go through it very, very easily. You know, HIV is found in the blood, semen, pre-cum or pre-seminal fluid is what we call it. We call it pre-cum. And rectal fluids. Yes, there's a such thing called rectal fluids. Sometimes, for us guys, just to throw this out there, that's where our hot spot is. You know how women did that G spot is back there. And when we engage in sexual activity and it's feeling good, that G spot starts to secrete those rectal fluids. Or even if you like getting played back there, um, and that G spot is hitting, yes, you can get wet back there. Just to throw it out there, since I'm talking about rectal fluids. Um, so having your partners pull out before you ejaculate cum does not decrease your risk. That pulling out method has never worked. It don't work for pregnancies. It won't work for HIV. Pre-cum is the most potent of the cum. All it takes is one little semenoid, one little sperm to flow up through you and to get you pregnant for you ladies or to infect you with HIV. It just take one of them. That's all it takes. And all it takes is one time. If you are a bottom, always use a new condom, like I said earlier, with a water-based lubricant. This will help minimize the damage to your rectum during anal sex and lower your risk of getting HIV and other STDs. If we're moving on to topping, as I said, topping without a condom is considered a high-risk behavior because of the transmission of bodily fluids, but the risk is not as high for bottoming. The partner receiving anal sex is at greater risk than the partner topping, as I said. If you are topping, though, always use a condom, once again, with a water-based lubricant. This will help you. Because keep in mind, you're topping. If you're going in raw, you still have your urethra tube right there that fluids can flow up. I mean, that's where your sperm comes out of. The fluids, just like something can go in it, just like something can come out of it, like you're peeing your sperm, fluids can flow right back in there. So using a condom is always important. Um, Vaginal sex for women, just like I told you guys, just like I said, the lining down there is thin. It's very the same. You want to use a condom. Want to use a condom. There are many barrier methods to use to prevent pregnancy, such as a diaphragm or a cervical cap. But you want to make sure that you're protecting yourself too, ladies. And also, my heterosexual men use condoms because fluids still transfer the same way. So you want to make sure that you are protecting yourself. That's how you can reduce your risk. That's how I'm gonna start reducing whenever I get back into that motion or feel like I'm comfortable enough to do that. I'm gonna be sure that I'm using condoms. I'm going to be sure that I'm using water-based lubricants. I'm going to be sure to fully disclose to my sexual partner, whoever that person may be, that I am HIV positive, which is another thing that keeps that's another. I didn't really talk about that, but I'm just going to say it now. Another way that HIV is spread, and it spreads so rapidly, so many people, not only people are unaware, those that know that they are HIV positive, they don't disclose that to other people because they feel that, oh, well, now they're not going to want to have sex with me. Now they're not going to want to do it. And 9 times out of 10, you're probably right. But it is your responsibility. I said, it is your responsibility. I'm flubbing over this. It is your responsibility. It is your responsibility to disclose your HIV status to that person because you're putting them at risk. Not only that, you can get sued for that. You can, if something happens to that person, you can go to jail for involuntary manslaughter, or if you knowingly did it, voluntary manslaughter. I am a criminal justice student, so I've done essays and papers about this. It's something. I mean, come on, it's something that happens. A lot of people don't disclose that to their sexual partners, so that is very important. The overview that I want you to take from this, really though, is use a condom. Start practicing safer sex. There is no safer sex than sex with condoms. There is no safer sex than that. I don't know how much more I can say about that. The choice is ultimately up to you. Are you going to have sex? Are you going to have safe sex, or are you not? If you're not going to have safe sex, make sure you go through the proper channels. Make sure you and your partner is getting tested. Make sure that you both are negative. But I advocate that you use a condom at all times, and you still go get tested. This is the conclusion of our video for today. I think I've talked long enough. This is probably about 20 minutes. I've been noticing that the videos are getting longer and longer each day, but I'm going to try to keep them like at 20 minutes. As I always say, feel free to email me at mrisaacjoseph@hotmail.com with any questions or comments, or you can always leave them in the comment box down at the bottom. You can also find me on Facebook at Izzy Joseph. Izzy is ISSY JOSEPH. Or you can find me on Instagram at Izzy_Joseph. Feel free to contact me there. I'm here to talk to you if you just need someone to talk to. If you are a person that is going through this HIV treatment, you're not alone. I'm going through it with you. Sometimes I need a shoulder to cry on. And this is sort of my therapy for myself. So I hope you all have a wonderful, happy Thursday. It's almost Friday. And I just hope you guys have a good time. So peace out. Love you. Bye.